Hello, we are here to present a research about perceptions and beliefs related to COVID-19 in Romania. Building on measures tested in other countries, we identified the public's vulnerability to conspiracy narratives and its willingness to comply with public health regulations. Using structural equation modeling, we check if individuals with pro-Russian or anti-Western attitudes believe more strongly in COVID-19 conspiracy narratives compared to the rest of the population. Then, we check if those believing conspiracy narratives are less susceptible to comply with public health recommendations. As you will see, there is a high level of support for both of these claims. In our surveys, we monitored on a weekly basis the level of concern about the new coronavirus in Romania. The peak of the concern was in April, and the lowest level of concern was in July. This is consistent with Google Trends and online mentions in traditional and social media, as you can see in these graphs. Therefore, we selected these moments to run two larger surveys to evaluate the effects of conspiracy belief on compliance with official coronavirus guidelines. Previous research found a negative relationship between believing in conspiracy narratives about COVID-19 and compliance with public health recommendations. Distrust in national institutions favored the appearance of conspiracy narratives. At the same time, foreign influence efforts, mostly coming from Russia, promoting conspiracy narratives were recently uncovered. What does that mean for Eastern Europe? Does trust in Western and non-Western actors influence the level of conspiracy beliefs, which in turn influence whether people take precautions against coronavirus infection? Our main research question is whether there is an indirect relationship between trust in international actors and non-compliance with regulations, and what is the role played by the conspiracy beliefs. We start with testing three hypotheses. First, people with higher degrees of trust in Russia tend to be more susceptible to believe conspiracy narratives. People with lower degrees of trust in the West tend to be more susceptible to conspiracy narratives. Finally, a higher belief in conspiracies is associated with a lower predisposition to comply with official public health recommendations. But this is the simplified model. And we add two more factors. And these two factors are knowledge and concern. Believing conspiracy narratives makes people less likely to be correctly informed about the transmission of the virus or concerned about the seriousness of the crisis. Finally, being misinformed and unconcerned will translate into a lower compliance with regulations. If our model is confirmed, it means that the direct effect of trusting Russia or distrusting the West on compliance with regulation is smaller than the indirect effect. To collect data, we fielded two surveys, a probability-based telephone survey and a non-probability web survey. The first was carried out at the height of the crisis. The second was carried out online after the end of the emergency state in Romania. Now, a brief discussion about the methods used. We measure each of our main concepts through multiple indicators. We run confirmatory factor analysis to define them as latent variables. Our hypotheses are linked in a path model. A path model can be pictured as a series of regressions, where a variable can be dependent in one regression and independent in the next. Both confirmatory factor analysis and path analysis can be modeled together under a framework of structural equation modeling. In our case, we check whether conspiracy beliefs can act as a mediator between trust in international entities and compliance with national regulations. The 6 latent variables are constructed based on an ordinal level indicators, Likert type scales. Indicators are formulated both positively and negatively in order to reduce bias. We use control variables shown to influence conspiracy belief in previous research, such as populist attitudes, media consumption, or sociodemographics. The results from confirmatory factor analysis show an adequate level of construct validity. We show the example of conspiracy belief latent variable which contains the largest number of items. The items load on the latent variable with the expected sign, the pro-conspiracy statements with positive sign, and the anti-conspiracy statements with negative signs. And here are some aggregated results from the smaller phone survey measured in April. For example, 70% of the respondents believed at least one of the three conspiracy narratives, and only 1/3 of the respondents appreciated that COVID-19 appeared naturally. By varied analysis on the phone, surveys show that the public that trusts Russia is more inclined to believe conspiracy narratives, and that the public that trusts the EU and the United States is less inclined to believe conspiracy narratives. For example, 60% of the pro-Russian public agreed that the pandemic was planned by big corporations or states, compared to the 40% of the pro-European Union public. Now, we test our path model with multivariate linear regressions. In the phone survey, the hypotheses are confirmed. Conspiracy beliefs decrease with trust in the European Union and increase with trust in Russia. Also, the higher the belief in conspiracy narratives, the lower the compliance with COVID-19 regulations. When testing the effects on the second survey, with all 6 latent variables, the relationships are even stronger. Our more complex path model is also confirmed. People with increased conspiracy beliefs are less concerned and have less correct knowledge about the virus. Also, the less concerned or worse informed are less likely to comply with regulations. The next slide shows the detailed regressions results with control variables. Conspiracy beliefs decrease with trust in the European Union and education, and they increase with trust in Russia, populist attitudes, and trust in Facebook. Knowledge decreases when conspiracy beliefs are high, but increases with media use. Concern also decreases when conspiracy beliefs are high, but increases with knowledge, age, and trust in institutions. Compliance with COVID guidelines increases with correct knowledge and concern about the virus. As you can see, all the effects are consistent with our expectations. The R-square values are high, showing that the model explains a large part of the variance. There is no significant direct effect between trust in the West and or Russia and compliance or non-compliance with the regulations. However, several indirect paths between trust in the West or Russia and compliance exist. The strongest is from distrust in the West to stronger conspiracy beliefs to decreased concern to reduce compliance. In summary, we find support for all our hypotheses in both models. H1B seems stronger than H1A, and H6 has more support for trust in the West than for trust in Russia. In other words, not trusting Western actors shows a stronger direct link to conspiracy belief and indirect link to non-compliance, compared to trusting non-Western actors such as Russia. Our model explains some indirect relationships which can offer much more insight for the future. The first indirect connection is related to the level of actual knowledge regarding the new coronavirus, the implication here being that stronger and better tailored communication efforts from official and credible voices can increase people's levels of understanding of this new threat, as well as their predisposition to comply with the safety recommendations. The second indirect connection we explore is also extremely relevant for the future. People that believe conspiracy narratives are less inclined to be worried about the epidemic and furthermore less inclined to comply with official health regulations. We find in both surveys that holding conspiracy belief is a mediator between distrusting Western actors and non-compliance with COVID guidelines. The results seem to indicate that the current COVID crisis can indeed be used as a perfect environment for geopolitical actors to disseminate and promote disinformation and conspiracy narratives, meant to induce doubts in national institutions and authorities and weaken trust in the West among the Romanian population. Our research points out grave vulnerabilities. By revealing these vulnerabilities, such studies can also become a source of solutions and help guide the effort to fight disinformation. Thank you so much for your attention.